Upper end of the tibia bone. This is upper end, shaft and the lower end. Upper end we have to learn three things. First is condyle, then intercondylar area and the tuberosity. This medial condyle, it is larger than the lateral one. It is oval in shape. It is nearby circular. This superior surface of the medial condyle articulate with the medial condyle of the femur, and this superior surface of the lateral condyle articulate with the lateral condyle of the femur. Both are slightly concave. Okay. Then the peripheral part, it is flat in both sides. The peripheral part of the condyle are flat and it is separate. This medial condyle is separated from the femur by the medial meniscus, and this is separated from the femur by the lateral meniscus. Then the surfaces. This is the medial condyle. This is the anterior surface of the medial condyle, medial surface of the condyle and the posterior surface. Anterior and the medial surface of condyle, medial condyle has numerous foramina, vascular foramina. Okay, and in the posterior it is marked by the groove. Then the lateral condyle. The anterior aspect, it is a flattened impression that is known as Gerdy's tubercle, and in the posterior it is also marked by the groove. And in the posterior inferior, this is the posterior surface and this is the posterior inferior aspect. It articulates with the fibula. Then the intercondylar area. This is the intercondylar area. This intercondylar area, it is rough area and it is situated superior surface in between the two condyle or in between the two articular surface of two condyles. Okay, and it is narrowest in its middle part. Then the tuberosity. This tuberosity, it is located anterior aspect of the upper end. This is the anterior aspect. Then inferiorly it continues with the anterior border of the shaft. First of all, it is located in the anterior aspect of the upper end of the tibia, and inferiorly from this it continues with the anterior border of the shaft. This tuberosity is divided into two parts. First is upper part and the lower part. Upper part, it is smooth area and the lower part, it is a rough area. The epiphyseal line passing of the upper end through this junction. Epiphyseal line is passing through this junction.